This is the digestive system beginning on page 208 with the anatomy. Food enters the body via the mouth and travels through the pharynx, esophagus, and stomach to the small intestine, also known as the duodenum. The liver, gallbladder, and pancreas make and store chemicals that aid in the digestion of foods. Digested or broken down food is absorbed into the bloodstream through the walls of the small intestine, the jejunum, and the ileum. Any substance that cannot be absorbed continues into the colon, also known as the large intestine, and leaves the body through the rectum and anus. Our terminology, we have our combining forms, meanings, and then our terms. First, we have ano, which means anus. Anal means pertaining to the anus, the opening of the rectum to the outside of the body. Next, appendo means appendix. Appendectomy is removal of the appendix. Appendico also means appendix. Appendicitis is inflammation of the appendix. Cholecysto means gallbladder. Cholecystectomy is removal of the gallbladder. Colo means colon. Colostomy is an opening of the colon to the outside of the body. Colono also means colon. Colonoscopy is visual examination of the colon. Duodeno refers to the duodenum. Duodenal means pertaining to the duodenum. Esophago means esophagus. Esophageal is pertaining to the esophagus. Gastro means stomach. Gastralgia is stomach pain. Hepato means liver. Hepatomegaly is enlargement of the liver. Ileo means ileum. Ileostomy is a new opening of the ileum to the outside of the body. Jejuno refers to the jejunum. Gastrojejunostomy is new surgically created opening between the stomach and the jejunum, which is the second part of the small intestine. This procedure is an anastomosis. Oro means mouth. Oral is pertaining to the mouth. Pancreato means pancreas. Pancreatitis is inflammation of the pancreas. Pharyngo means pharynx. Pharyngeal is pertaining to the pharynx, and the pharynx is the throat. Procto means anus and rectum. Proctoscopy, inspection of the anus and rectum with a proctoscope. Proctoscopy is often performed before rectal surgery. Recto means rectum. Rectocele is a hernia or protrusion of the rectum into the vagina. Sigmoido means sigmoid colon. Sigmoidoscopy, visual examination of the sigmoid colon with an endoscope inserted through the anus and rectum. And stomato is mouth. Stomatitis is inflammation of the mouth. Next is our pathology section for the digestive system. Cholelithiasis is abnormal condition of gallstones. Cirrhosis, chronic disease of the liver with degeneration of liver cells. Colonic polyposis, condition in which polyps protrude from the mucous membrane lining the colon. Diverticulosis, abnormal condition of small pouches or sacs, diverticula, in the wall of the intestine, often the colon. Diverticulitis is inflammation and infection within diverticula. Gastroesophageal reflux disease, also known as GERD, a condition in which contents of the stomach flow back into the esophagus. Hepatitis is inflammation of the liver. Inflammatory bowel disease, IBD, inflammation of the terminal or last portion of the ileum, which is Crohn's disease, or inflammation of the colon, ulcerative colitis. Irritable bowel syndrome is IBS. Signs and symptoms are cramping, abdominal bloating, constipation, and diarrhea. Although IBS causes distressing symptoms, it does not permanently harm the intestine. Its cause is unknown. Hepatocellular carcinoma, or HCC, is primary cancer of the liver. Jaundice is yellow-orange coloration of the skin and other tissues from high levels of bilirubin in the bloodstream. This is hyperbilirubinemia. And peptic ulcer, an open sore or lesion that develops in the lining of the stomach, gastric ulcer, or the first part of the small intestine, duodenal ulcer. Next are our laboratory tests and diagnostic procedures for the digestive system. Abdominal computed tomography, or CT scan, a series of cross-sectional X-ray images that show abdominal organs. Abdominal magnetic resonance imaging, or MRI. Magnetic and radio waves create images of abdominal organs and tissues in all three planes of the body. Abdominal ultrasonography, process of beaming sound waves into the abdomen to produce images of organs such as the gallbladder. Endoscopic ultrasonography is useful to detect enlarged lymph nodes and tumors in the upper abdomen. Barium tests, X-ray examinations using a liquid barium mixture to locate disorders of the gastrointestinal tract. In a barium enema, lower GI series, barium is injected into the anus and rectum, and X-ray images are taken of the colon. In an upper GI series, barium swallow, barium is taken in through the mouth, and X-ray images reveal the esophagus, stomach, and small intestine. Cholangiography, X-ray examination of the bile ducts after the injection of contrast material through the liver, percutaneous transhepatic cholangiography, or through a catheter, a flexible tubular instrument from the mouth, esophagus, and stomach into the bile ducts, endoscopic retrograde cholangiopancreatography, or ERCP. Next, we have gastrointestinal endoscopy, visual examination of the gastrointestinal tract with an endoscope. Examples are esophagoscopy, gastroscopy, colonoscopy, and sigmoidoscopy. Hemoccult test. Feces are placed on paper containing the chemical guaiac, which reacts with hidden or occult blood. This is an important screening test for colon cancer. Laparoscopy, visual examination of the abdominal cavity through an endoscope inserted in the abdomen. Liver function tests, or LFTs, measurement of liver enzymes and other substances in the blood. Enzyme levels increase when the liver is damaged, as in hepatitis. Examples of liver enzymes are ALT, AST, and alkaline phosphates. High bilirubin or blood pigment levels indicate jaundice caused by liver disease or other problems affecting the liver. And lastly, stool culture. Feces or stools are placed in a growth medium or culture to test for microorganisms such as bacteria. Next are treatment procedures for the digestive system. Anastomosis, a surgical creation of an opening between two gastrointestinal organs. Examples are gastrojejunostomy, cholecystojejunostomy, and choledochoduodenostomy. Colostomy is a surgical creation of a new opening of the colon to the outside of the body. Ileostomy, surgical creation of a new opening of the ileum to the outside of the body. And then laparoscopic surgery, removal of organs or tissues via a laparoscope, an instrument inserted into the abdomen through a small incision. Examples are laparoscopic cholecystectomy and laparoscopic appendectomy, which are types of minimally invasive surgery or keyhole surgery. Next are abbreviations for the digestive system. BE is Barria enema. Barium, a contrast agent, is introduced through the rectum and X-ray pictures of the colon are taken. GB is gallbladder. GERD is gastroesophageal reflux disease. GI is gastrointestinal. HCC, hepatocellular carcinoma. IBD is inflammatory bowel disease. We have Crohn's disease and ulcerative colitis. IBS, irritable bowel syndrome. LFTs are liver function tests. NPO means nothing by mouth. And TPN is total parenteral nutrition. Intravenous solutions are given to maintain nutrition.